This episode may contain mature content. Listener discretion is advised. Content warnings can be found in the episode description.
Hey, we are the Lab Doctors. I'm Amanda.
I'm Dorothy.
And I'm Zhao Yong.
We are biomedical researchers who realized we still have a lot to learn about science.
So why not join us on this quest?
Welcome back to the Lab Doctors podcast. On this week's episode, we're going to talk about
limb lengthening surgery.
Whoa.
This was like, because, was it last week we were talking about height?
Yeah.
Our 1-5 lows.
The episode that we talked about the association between height and medical conditions.
Yes.
But this won't help me with my medical conditions,
Will
I guess. Wait, will it?
Will it? Okay, so limb lengthening surgery, or I don't know what other names there are, like leg extension. It's
Leg extension. Sorry, I was just thinking about hair extensions and I'm like,
You add an extra feet. Okay, anyway, it's a medical procedure that aims to simulate bone and tendon growth in the legs. In the past, the methods were simpler. I don't know how effective, but then basically they just stretch your legs to encourage growth. Nowadays, the leg lengthening surgery is more common in people aged 18 to 25. The surgery involves... So I was watching this documentary and I was a bit like nauseous watching it because they show like a bit of the medical procedure and I'm like, y'all can go watch it if you are interested.
no thanks.
What's it called?
It's by CNA Insider called The Extreme Lengths to Grow Taller, Limb Lengthening Surgery in India.
Should we give content warning?
I mean, it made me slightly sick. So like, if not, just skip the parts.
As in because it's graphic, right?
Yeah. They show like in the surgical room and stuff like that. Which is kind of cool actually if you are interested.
Yeah, I guess if you're squeamish, then maybe skip those parts or not watch it. I don't know.
Yeah. So today, basically the surgery involves two approaches. But in the documentary, I think they did both together. So I'm going to describe what they did in the documentary. Okay, so the surgery is done at the shin. If you don't know where your shin is, it's the lower half of your leg, above your feet. Where there are two bones, the tibia and the fibula. So the tibia is the thicker bone at the front. And then the fibula is the thinner bone at the back. So first, an intramedullary nail, it's just a nail that is drilled parallel into the tibia bone.
Parallel to what?
Your shin bone. Like, it can't be horizontal if not it'll be sticking out. So it's like parallel to your bone. Basically, it's like through your entire shin.
So it's just like a pole. Wait, pole?
Yeah, something like that. It's like a nail. They call it a
okay.
nail. Okay, and that's not all. The nail is fixed to external frames known as the external fixator. Imagine Shang-Chi. Was it Shang-Chi where they had the 10 rings?
Yeah.
So imagine like just 3 rings around your shin.
Right.
Okay.
And it's connected to the inner bone. And then the outer 3 rings are like attached to make like a scaffold looking thing.
To hold it in place.
Yeah, so, and then somewhere along this process, the bones need to be broken. So like the surgeons will break your bones, probably at different heights. So like the tibia one was higher up and then the fibula one was lower. So what happens is when your bones are broken, then like the next few days after your surgery, right, the external frames will be stretched out a little bit by little bit, like millimeter by millimeter further from each other. And then the gaps where the bones are broken will be left to regenerate on their own to fill the gap. So it's quite a long process, quite a few months of recovery. And for this surgery, guess what's the maximum height that can be extended?
5
5
cm.
cm.
Apparently that's below average.
Oh.
How many cm would you want to increase your height to?
Mine? 5 cm.
You?
Yeah.
You're already 1.7 low. So you want to be 1.7 high. Okay.
I'm okay to say it. Are you okay to say it?
I'm okay with saying I'm 174. Yeah, 179. I feel like that's ideal.
Okay.
But that's quite tall actually.
We'll go into like...
Yeah. I mean, honestly, everything above 160 is tall to me. So it's not really a high bar.
Given that the average height in Singapore is like 1.7.
Again, I want the median. After the last episode, I went to Google the median because I'm very disturbed by
So
the
what's
average
the median?
mean. There isn't. They refuse to give it to you. And I'm like, I don't know. Unless I just don't look down.
I think you're biased, yes. Look down more at these short
I don't
people.
like the look down on people.
Not that there's anything wrong with being short.
Yeah, there's nothing.
How many cm do you want to increase?
I guess 5 cm. I don't really want to be that much
So
taller.
it'll be like 1.6.
Low.
1.59.
Yeah,
around.
159 maybe.
Yeah, I want to hit at least 1.58 so that I can be an air stewardess.
Wait, you can't make... Oh,
The
right.
cabin.
I can't
the
reach the
cabin.
above
The
overhead
overhead cabin.
Is that really an issue now? Like, can they still enforce such policies?
You still have to help, I guess.
Yeah. I can't be like, oh, sorry, I can't reach the way. You do it yourself.
Like, can't you just get someone to like help you?
No, but everyone's busy.
I don't know. It just feels very discriminatory. But anyway.
Yeah, it is. That's why I'm in this job. Just kidding. We love research. Okay, so the maximum length is 15 cm.
Whoa.
I think it's 14 or 15. I can't remember.
15
but
is one shot ruler.
Yeah.
That's a lot.
Is there a chance that your legs grow different lengths? So it's like one would be longer than the other?
I don't think so.
I think it's because you move the scaffolding and that determines like how much.
Yeah, but how do you ensure that the breaking is at the exact same place?
Okay, I'll go into that later. But the average is about 7 cm. So imagine you go through a surgery.
That's too much, right?
That's too much.
Don't
Too
wanna be
much
that
what?
tall.
As in,
Too much height for Chow Yong. 2 cm more? No.
That's too
I don't
much.
want that.
Yeah.
it's so funny how like 2 cm
No,
makes
it's too
a
much commitment. Then it's like, then maybe I need to bulk up a bit. If not, I'll be lanky. You know?
Yeah, you'll be skinny like a pole.
Yeah. It's like, nah. Okay, I'm happy. I'm happy where I'm at, I guess.
Yes, count your blessings,
Yeah,
okay?
yeah. Okay.
So when the patient is happy with their height increase, then the surgeons will remove the pin, basically. And in this documentary, apparently, you can also lengthen your thigh.
Oh.
So I don't...
Why?
I don't know.
Maybe you want your thighs to look skinnier.
Maybe
and
like if
longer.
you...
I don't know.
I don't know. Wait, either way it'll be improportionate, correct?
No, disproportionate.
Yeah.
Disproportionate. But it doesn't matter because some people's like shin is longer than other people's shin.
Yeah.
You know, like people have different leg lengths.
Yeah, so like which one is weirder? Your thigh is longer than your shin or shin is longer than the thigh?
Thighs longer than shin is weirder for sure.
Maybe that's why it's not encouraged.
Maybe there's too much like meat at the thighs.
Yeah, to get to fix the...
Yeah. Like I can't feel my bones at my thighs, but you can definitely feel your tibia, you know?
Yeah.
Or we could just have thick thigh.
Excuse
Muscular thigh.
You're such... I'm not going to say it on the pod.
I said we, because I also can't feel.
Okay.
I also can't feel my bone.
I hate you.
But I think it's less common because you can't really do that Shang-Chi thing on the
Yeah.
thighs. Because I don't know how you're going to walk. But yeah,
Wait, you can't walk. You can't walk with the shin thing, right?
you need to.
Huh?
Slowly by slowly. Slowly by slowly, a correct phrase. Little by little.
How?
But your leg is broken.
Yeah.
Yeah, but you need to...
Oh my god, and you're breaking 2 legs, right?
Yeah.
You need to, as in like, maybe a few days later lah. Then
A
you...
few days? Is that enough?
I don't know, you need to undergo physiotherapy to like make sure you can walk, and then when it's like down the road you do like more weight bearing exercises. But like
Yeah, I assumed after a month, after a few days.
I
Is
don't
that
know.
possible?
Yeah, I think so, because like you're discharged after a few days and then you only come back like once in a while to lengthen the thing.
Do you know what all this sounds like? It sounds like braces to me, like for the teeth. Kind of sounds like that.
Teeth are another set of bones anyway,
yeah.
but you don't break it.
But you don't
No,
break.
but you remove. Yeah.
Okay, back to the thigh.
Yeah.
So similarly, like an intramedullary nail is inserted into the femur, which is your thigh bone, and the bone is broken. And then in this case, they use an electromagnet to control the amount of separation between your bones. And like the patient can apparently control the length of extension themselves when they're at home recovering. Yeah. So for recovery, like what we said, they need physiotherapy, and you'll be given supplements like vitamin D or calcium to promote bone growth, and also painkillers because I think it's extremely painful. Oh, and bear in mind that not only your bone and tendon needs to grow, but also the muscle needs to grow back. Okay, so why do people do leg extension surgery?
Be taller.
There are more reasons.
Other reason. Yeah, like medically.
Oh, there are?
Yes, there are medical reasons. And in fact, it was invented to correct uneven leg growth as a cosmetic procedure.
Oh my god.
Yeah,
I
yeah.
literally thought about it just now. Okay. Anyway.
Yeah, you said it. Like,
Yeah.
what if it's uneven?
Yeah, so what if it's uneven? Basically, there could be a variety of reasons why one person's leg can be uneven, including like birth defects that impact bone growth, cerebral palsy, history of broken bones or injuries to the lower legs affecting growth, history of poliomyelitis, history of shortened or tight muscles, and this disease called PERDS, PERDS disease, which affects the hips and therefore like uneven legs.
Right.
So the leg extension surgery or limb lengthening surgery is only recommended by doctors thelabdoctors if the difference is about 2 cm. Which
It sounds little, but
Yeah.
I guess it's a lot.
No, it's a lot.
Yeah, for
Really?
like balance.
According to the Journal of Orthopedics and Traumatology, you only experience symptoms if the difference in leg length is about 4 cm.
Oh.
Apparently
why-
so. I'm not sure.
Okay.
Maybe you should wear like insoles. Actually,
Yeah.
no.
I was like, can I just wear insoles?
Yeah. So as in, of course, the preferable method is just wear insoles lah,
Yeah.
rather than go through like a leg extension surgery,
Yeah.
but which is so painful and obviously there's more like risk involved.
Yeah.
Okay, anyway, we talked about why the surgery is only in people aged between 18 to 25, right? It's because they are near the end of bone growth.
Oh, yeah.
Because you have to break the bones.
Yeah.
You probably want your bones to be already completely formed, but you also want it to be where you can still generate new bones. Of course, this surgery is possible in older adults, but it's usually not recommended. And what they actually do if your legs are uneven is to do a leg shortening surgery. So we reference this guy like who is very sad in the documentary, but this guy, he did his leg lengthening surgery when he was about 14, 15 years old. And basically it screwed up his life. Yeah, so in the documentary, he talked about how he was like scammed getting into this surgery because ultimately like when he finally found out old enough to understand like what's happening, it was his hip that was affecting his growth rather than the legs.
Oh no.
He's claiming that the doctor who recommended this surgery did not tell him that you needed to break your bones. He thought it was like maybe some medication where you just eat and you grow taller.
Right.
Yeah, so I guess it's just more
Uninformed.
uninformed decisions.
Yeah.
So yeah, basically don't do it when you're too young cause
You can still grow.
yeah. Okay, guess how much this procedure costs? I mean in USD lah.
20K?
$8,000.
The heck? Transplant surgery was 4,000.
Yeah. I'm going 8.
8,000?
You have to like put a nail in you and then you have to like
So
have
many
that ring.
months.
I'm going 8.
I feel like 20 was even too low.
Yeah, it's 75,000 USD in US. In India, they were doing it for like 30, around 30,000.
Does it go by the CM? Like if I'm less, then I pay less also.
No. So today is also used as a cosmetic surgery, as we have talked about. And it's crazy since the recovery is so long, right? Like it'll take you a few months and even like a year to get what you desire. So given that it takes so long, guess when the demand for the procedure increased?
COVID.
Yeah.
Of course. You can't go out anyway.
Yeah.
People must be like, yeah. No, but I can't imagine them doing these surgeries because, you know, during COVID, it's like only the most necessary procedures were being done. And then like a lot of surgeries got backlogged because it was like, oh, not urgent enough.
Depends on the clinic, I
Yeah,
guess.
I think so.
Oh my gosh.
Imagine you go private and it's
Yeah.
like they're not
True.
just getting COVID patients. So
Wow.
yes, COVID, more people started doing it. And apparently because like in India, it's kind of frowned upon to do it. And therefore like in India, the demand for it rise during COVID where you don't see people that much. So let's go into the ethical issues or like improve your health. Given that the previous episode, we talked about how short people are generally.
Okay, so if you're shorter, you're more likely to experience cardiovascular
Yeah.
risks, whereas in taller people, height is associated with all the other diseases.
Yeah. So then, will making you taller help you in your health?
Probably not.
I feel like the only thing would be the social aspects. You know, they also talk about like the mental or like the social, like because it's more socially desirable to be taller.
Yes.
But if you're ugly, you're still ugly. What? I don't really get it.
Oh my.
Yeah, that is for people who are conscious.
Yeah.
So like some people, they do it cause it's hard to find a spouse if as a guy you are too short. As in, or like the female's taller than you.
I mean, to each their own. Okay,
Yeah,
but-
so then also like for some people when they go to like, you say they go to US and work, right? Maybe because Westerners are taller in general. So then you feel like you don't have that kind of power that you can exert. So then they want to do these kind of procedures.
Yeah.
So there's a lot of effects on.
Okay.
Basically, that's that. Like the controversy now is should they allow people to go through this procedure where basically you're breaking your bones to tackle their mental health issues?
Oh.
That's the thing. So in the documentary, right, the father, who is the surgeon, who specialized in this limb lengthening surgery, and his daughter, who's apparently not too tall, wanted to do this surgery as well. So from young, she has been telling her father like, oh, let me do this surgery. But then as she grew older, she realized, okay, that there's a lot of risk involved. And then she became like a psychologist or something like that. So she realized that, yeah, height's just a number kind of thing. Like just accept yourself for who you are. So then she started counseling people who face this kind of like psychological physical issues with their height. Yeah, it's like a father-daughter team.
No, that's good.
Yeah.
That's
On
great.
opposite ends.
No, it's good. It's like the father is the last resort,
Yeah,
I
I think
guess.
it's like a very
Which is
ethical
good.
practice if that's the case.
Yeah.
I mean, from what we've heard.
Yeah.
It's like, I mean, before you do any cosmetic procedure, I think it's good that you get a counselor or someone to talk you through.
They usually have that, right?
Do they? I'm not too sure.
I'm not too sure if it's like simple. I don't think it's for very, very simple like double eyelid surgery. I don't think. But like if you want,
But it's informed enough, I guess.
Yeah.
People will tell you about the
hope.
risks.
I hope,
yeah.
yeah,
I guess the question is, would you do it?
No.
I wouldn't lah. I think short has its benefits.
I just feel bad for those people. Like,
Wait, which people? Those who have mental, like as in they psychologically want to do it?
both, like the people who medically need to do it and the
Yeah.
people who like do it for psychological reasons, I guess. It's like, that's kind of sad, isn't it? It affects you so much that you're willing to break your bones to be
Yeah.
taller. I think the conclusion is make sure you are informed of all the risks and just think about it before doing it.
Go through counseling before doing it.
Yeah.
But I really think it's not worth.
I don't think it's worth it as well. Everyone is beautiful as they are. And as usual, subscribe to our YouTube channel and follow us on Spotify. A like and a comment would really help us up, like mentally. So we don't need to go for like artificial injections of like influence into our
Veins. Blood.
veins. Right?
You can also follow us on social media, Instagram, Twitter, or Facebook, and feel free to DM us any questions.
Alternatively, you can email us at thelabdoctors@gmail.com. We'll put the links in the episode description if you're curious.
Watch the documentary.
Or not. I mean, it's free. Bye.
Bye.
It's free, right?